Good day, it's Dr. McLean with Vital Energy Chiropractic. Have you ever been in a car accident or a sudden stop type of injury? This could have been from skiing. I remember as a kid having lots of bike wrecks. I rode my dirt bike and I was always go off jumps and things like that and wiping out. Could be from sports. Could be playing football where you had like a sudden stop or softball, or even just like a fall on the ice. So here's the thing, that injury at that time didn't have to hurt at the time. Sometimes I have people come in as new patients and I'll go through the paperwork and I'll say, have you had any major injuries in a car accident? Well, I had a car accident, but it was 20 years ago. I'm like, well, that's even more important than the one that you might have had last week. And the reason is, when you think about a whiplash type of injury or a sudden stop type of injury, if I'm in a car, for example, and another car comes and hits me from the side, my body's going to get pushed to the side, and for a split second, my head is going to remain in place. And these tissues and ligaments and potentially the disc and the nerves are going to get stretched and damaged on this side of my neck. And then, of course, as my body keeps moving, my head has to catch up. These tissues are now going to compress and actually slingshot or catapult my head the other direction. And again, now stretch and damage, potentially damage all the tissues on the other side of my spine. So you can see, because of that slingshot or catapulting effect, I might have only been hit going maybe 5 or 10 miles an hour, but my head is going to go a multiple of that, potentially 20 or 30 miles per hour, even more. So this is where you can have a very minor, seemingly minor impact. Again, a car accident going just maybe 5 miles per hour. There's no visible damage to the car, but it can greatly damage that person. And they may not feel the pain right away. In fact, if we look at the disc of the spine, if we damage what they call a motor unit, if we damage this area of the spine and it doesn't move properly, you may not feel anything in that moment, that day or that week or even months later. But because that's not moving properly, that bone and that disc will start to degenerate. And over time, somebody gets older, maybe 20 years later, they go to the doctor with back pain and they diagnose them with degenerative disc disease, meaning this disc just decided on its own to degenerate. But if we look at a couple discs above it, it might look totally normal, even though that disc above it is the same age as this disc that's massively damaged. And it's because it got injured at one point and is not moving properly. So I want to highly encourage you, if you have friends and family that have ever been in a car accident, or especially if they're in a car accident recently, to get their spine checked right away, even if they have no symptoms or symptoms that may seem unrelated, because it can cause things like irritation, mental irritation, anxiety, depression, vision problems, dizziness, what may seem like an inner ear infection, all these consequences that may seem unrelated to the injury. Can create things like anxiety. I remember a patient telling me one time he was out hunting and he fell, tripped over a stick, and kind of this whiplash type of injury. He said immediately he started to get anxiety. He'd never had anxiety before. Like the next week or two, he had really significant anxiety, and we could see it was pressure in the top part of his spine. So again, if you've had this injury, make sure you're maintaining your chiropractic adjustments to make sure that spine's moving the right way, because you can actually potentially heal that disc, sometimes back to normal, but at the very least, prevent it from continuing to degenerate. And then even more importantly, of course, if that disc space degenerates, it shuts down that nerve space coming out, and it's going to affect your heart, your lungs, and you have all sorts of other problems along with just the pain. Or maybe you don't have any pain, but it's affecting the nerve going to your heart or to your immune system. So let your friends and family know, especially if you got a spouse that, hey, they're not having any back pain or neck pain, but they're in a significant car accident or a fall 10 or 20 years ago. I'm not trying to scare them, but get checked now before you start to have problems. Maybe they don't have a spinal problem, but find out. The only way to find out is to get checked. Get an x-ray, get a spinal exam, find out what's going on. If you have any questions on this, please let me know.